Today's topic is going to be so big, it's going to take up both podcasts, both the rehab and the fitness side of things. We're going to be talking about the age-old statement, exercise is medicine. Today, we're going to be looking at it from a rehab point of view, both for the providers and the patients out there. Tomorrow, we look at it from an exercise point of view for clients and trainers and anybody else who's working with the general public using fitness as their tool. There's plenty to chew on today, information for everybody involved. For the providers, we're going to start with them first. We're going to move on to the patients in the second half of today's podcast. So if you're either of those, stick around and we'll break down the idea and the problems with exercise is medicine. Don't go anywhere. Defending mediocrity in our profession. Welcome back from the intro. This is the Dr. Krol PT and Fitness Podcast. I am your host, Dr. Lee Krol, physical therapist. And again, we're going to go over all the basic stuff here about exercise as medicine. But first, hit that like, hit that subscribe, help grow the channel, help get people hearing about this. Share it on your social media, tell people about it. This is how we get this message out there. This is how we grow. I'm not everybody's cup of tea, but what I have to say on this stuff, pretty important topic, pretty important discussion, so let's get this word out there. A lot of years ago, many years ago, the statement exercise is medicine was thrown around in our industries, both rehab and fitness. The big coin term, it's like the word functional got thrown around all over the place. Exercise is medicine really dominated our profession for a while, and I still see it quite a bit. It's really an excellent statement. It really is, at its core, a very true statement. But unfortunately, we got behind it in name only in our profession, the rehab profession. It became a quick statement to showcase the importance of what we do. We wanted to show the public that exercises are not just random, haphazardly given out things, but actually medicinal and thought about. Then we started giving them out haphazardly and without much thought. Let's start at the top. Let's start at the definition of medicine, because when we say exercise is medicine, we want everyone to be on the same page of the book here. Medicine is defined as, quote, the science or practice of the diagnosis, treatment, and prevention of disease, end quote, or, quote, a compound or preparation used for the treatment or prevention of disease. That's the Oxford definition of medicine. So what does this really mean from a provider's point of view, PTs in particular? I'm going to start with the provider side of things. What it really means is we have to diagnose first. That means us, we do, not the physicians, not the physiatrists. We have to diagnose first before we give out any type of exercise. If we don't, we're simply a dispensary, like a pharmacy. We're not really doing any type of real medicine. We're just dispensing something that somebody else told us to give out. We have to diagnose first. So when a patient comes in and tells us, my back hurts, or what exercises can I do to help it, we have to make sure that we're the professionals. We have to stop and diagnose the issue. We have to diagnose so we can properly prescribe our medicine, which is exercise. That's really what we do in terms of the PT profession. We can give out modalities, we can give out, certain types of, non-invasive modalities, kinesiotape, electric stim, ultrasound, but really the big bread and butter of what we do is our manual therapy and our prescribed exercise that the patients do at home. We have to take that diagnosis seriously. So what I want all of you to do from a provider standpoint, students, seasoned physical therapists, long practicing physical therapists, I want you to be really honest with yourself here. How many of you have seen the patient with a diagnosis of shoulder impingement or a chief complaint of low back pain And before the patient walks in the door, you already know what 3 or 4 exercises you're going to do. You already know what progressions you're going to do. Be really honest here. If that's the case, if everybody with shoulder impingement gets 3 of these 4 exercises, then why did they have to come and see you? You're not diagnosing anything. You just pulled the exercises out haphazardly. And I know this happens because I've actually seen it done. I saw someone fill out an exercise card and progressions for a week or 2 later and progressions for a week or 2 after that before the patient ever even walked in the door. So it didn't matter what the patient said. That's what they were going to be getting regardless of how they presented in the exam room. It didn't really matter. So at that point, those exercises are no longer medicine. Not to me, they're not. You haven't diagnosed anything. You just pulled the exercises out of the drawer or out of the air and gave them out. You went off a physician's medical diagnosis without checking it yourself. I can tell you from my experience, I disagree with the physician's diagnosis more than I agree with it in many cases. I mean, and honestly, 50% of the time, I'll see someone, they'll say they have adhesive capsulitis or a frozen shoulder in layman's terms, and 20 minutes later they're moving their arm completely overhead. That's not a frozen shoulder. That's something else. So I'm not going to go off of physician's medical diagnosis. I will use it as a starting point. I'll use that as information. Whatever the physician found is good information, but I'm going to diagnose it myself. And if I haven't come up with some sort of a functional diagnosis or a rehabilitation diagnosis, then how do you give out exercise? You're just dispensing at the physician's request, or you're just dispensing based off a medical diagnosis. That's easily automated, and we put all out of a job pretty quickly. But back to the main topic at hand, these things, if we treat them as medicine, then they all have side effects and dosage limits. Every individual is affected differently by exercise. So if 8 people come in with shoulder impingement and you give out the same 3 exercises for all 8 of those people, you're going to have a wild variance in results. Some people are going to do really well with it. Some people are going to do poorly with it. Some people are going to get worse. And you would have known these things right off the bat if you would have checked and rechecked. And that's a big hallmark of what I think is good physical therapy, is doing a check, getting a baseline, doing some sort of intervention, and then rechecking the baseline to see if you actually made a difference. If it made a difference, that's part of their home exercise program. If it didn't, then you move on to something else. But all medicines, all pharmaceuticals have a dosage limit and side effects. Every single one of them does. Even over-the-counter medication have certain checks on them. Should you be taking ibuprofen if you have stomach ulcer or a history of stomach ulcer? Probably not, at least not without checking with a physician first. Exercise has those same checks like I talked about. Should you be flexing forward to stretch your back? Maybe. But if you have a lumbar derangement, then it may not be the best direction for you to go in. Maybe extension would be better. Maybe side gliding would be a better answer. Maybe none of those would be a better answer. Maybe traction would be a better answer. We don't know until we check it. We have to diagnose it properly first and then see what type of treatment is actually going to be beneficial for you. If you have low back pain, can you do a series of stretches that you find online? Sure. But your low back pain could be caused by an organ issue, a pelvic floor issue, some other issue that would require a different level of biomedical intervention. Those stretches aren't going to help. In fact, I would argue they're actually going to hurt you because they're going to delay your care. They're going to delay you getting to see the right individual to help you with your condition. Most of the exercises and movements that you can find online, they're fine in a vacuum when prescribed, all right? Meaning that a diagnosis was made and those exercises were deemed clinically appropriate for you and your presentation. And that presentation and if that exercise is appropriate may change from time to time. So if you have low back pain one year and the physical therapist decides, hey, shifting your hips to the left multiple times every hour is the right answer for you, if you have low back pain a year later, that may be the exact opposite. You may be shifting your hips to the right, you may be extending, you may be doing none of the above. All right, so the exercise is really just prescribed off of your presentation at that time, and it's really prescribed off of the diagnosis that the physical therapist or the chiropractor or whoever is going to make. We in the medical profession, the last thing for the providers here, we have to hold ourselves accountable. If we're haphazardly giving out exercises, then we're not treating them like medicine. And if we don't treat them like medicine, then the patients and the general public are not going to treat them with the same esteem that medicine should be treated with. As for the patients out there, I told you I was going to get to you too. I get asked all the time by people out there, what exercise can I do for blank symptom? Knee pain, back pain, hip pain, shoulder pain, neck pain, ankle pain, it doesn't matter. What exercise can I do for this? And the reality is, and this is what I tell people all the time, I tend to be pretty unpopular with people who just want to ask me this question quickly. I tell people all the time, I don't know. I have to look at you first. I have to take my time, do an actual examination, and make a diagnosis. I can't prescribe anything without diagnosing what the problem is. To me, that's pretty irresponsible and potentially dangerous if you just hand out exercise, because I treat it like a pharmaceutical, I treat it like medicine. If you just hand it out haphazardly, to me that's really irresponsible. It's really dangerous, because if we're delaying your care or we're not getting you to the right person, then we could have a serious problem in our hand that got worse. Most of my colleagues out there don't see it that way. They post exercises online all the time for what to do for low back pain, for knee pain, for hip pain, without the disclaimer. The disclaimer should talk to the patient out there saying, hey, if you have knee pain, see a medical professional first to see if these exercises are the right thing for you. You should be seeking out a diagnosis from a medical professional if you're having a clinical issue like persistent pain. And as for the patients out there, when people come up to me on the street, when people come up to me or ask me a question, shoot me a text message, I don't expect them to know that. I don't expect them to say, well, I really should make an appointment for him to look at me. They look at it as, well, he's a PT, and I know he does this for a living in this type of environment. Maybe he can just give me something real quick that will help. And I don't expect them to know otherwise. So I don't get upset or anything. It's just I try to educate at that point and say, we really should be making a diagnosis. The way we've treated exercise as a profession, I don't expect people to take it seriously. I don't expect the lay people to take it with the same type of regalness and level that you would take a narcotic. A narcotic is seriously prescribed. Exercise is just sort of haphazardly given out. So going back to the providers for a second here, this would be a really good time to put in your queue my talk about devaluing our profession. This would be a really good time to do so. All right? But exercise is exactly that. It is serious, and it should be administered seriously. Proper diagnosis makes for efficient care. So I'm still talking to the patients here. I'm still talking to the lay people that have low back pain or knee pain, hip pain, shoulder pain, doesn't matter. Proper diagnosis makes for efficient care. If I take the time to diagnose you and make sure that the exercises are working properly for you, they're appropriate for you, and they're making a difference, that's actually the fastest way to get you to your goal, which is to be pain-free and have your function return and be able to get back to whatever activity you want to get back to. If that exercise is not the best answer for you, if I find that exercise in general is not the best answer for you, that's still the fastest way to your goal, because then I'm going to refer you to the right provider, the right person with more information to say, we did this, this, and this. Here were my findings. We weren't able to make a difference. I'm going to put the ball in your court now, either a physiatrist or it doesn't matter who else, or maybe a specialty PT like a rehab, pelvic floor rehab or something like that, lymphedema, vestibular, whatever it is, something that's a little outside of my specialty. I'll refer people out to them all the time. And that, again, is the fastest way to help you get better, instead of just sending you a text message with a picture. Yeah, do this exercise here because this works for a lot of people that have low back pain. That's, again, irresponsible and potentially dangerous. And for you, the patient, it's not the fastest way for you to get better. The fastest way for you to get better is to come in and see the physical therapist, to come see the physiatrist and really get a diagnosis and find out what you should be doing. Let the professional take a real look at you. If you stop them and ask them to check you real quick, you're really doing yourself a disservice. Let them take the time to take a look at you, come up with a real diagnosis, get you the right exercises to do, get you the right movements to do, get you the right tools to help you get yourself better, or get you to the right practitioner if needed. The reality is, we all have to start treating exercise truly as the medicine that it is. Quick sayings and hashtags are fine, but we actually have to do it all the way. If not, we really diminish the value of the statement. So if we were to say exercise is medicine, and then we don't treat it that way, we don't treat it with the seriousness, then unfortunately, nobody else will either. If we say hashtag PT first, and then provide low-level quality of care, then we're not really doing that statement any justice. We're not doing justice to the people. The really good PTs out there who are doing everything right are getting dragged down by the people that are just kind of throwing those tags out there. If we don't take it seriously, then the patients and the general public won't take it seriously either. Exercise truly is medicine, and we on the provider side have to take that seriously, and hopefully you on the patient side will begin to take it seriously as well, and know that the first step, the very first thing you should be doing if you have persistent pain and that you're ready to get it taken care of, is really come in, see a provider, let them do a workup on you, and come to a real diagnosis and real treatment for you. It's the fastest way for you to get to your goals, I promise you. It doesn't matter where we have to go, we just start gaining information and then we can help you a lot better. Thanks for listening today. This is the first part of the Exercise is Medicine. Tomorrow I'm going to get into Exercise is Medicine from a fitness standpoint, talking to the clients out there and the trainers, the yoga instructors, Pilates instructors, personal trainers, really anybody who uses exercise as their tool to get people better. So that's what we're talking about tomorrow. This is a pretty big topic, so I wanted to break it up. I didn't want to make one really long podcast that spirals in all different directions. So again, if you made it this far, we're about 17, 18 minutes into the video. Hit that like, hit that thumbs up, share it, subscribe to the channel, get people talking about this. If you want to leave a comment, that's great too. Leave a comment, let's spur some discussion. If there's anything in particular you want to hear on the podcast, send me a message. You're going to see my email at the end of the podcast, at the very end. You can leave something in the comments section. I'm easy to find on social media, Instagram, Facebook, easy to find. Come find me, hit me up with the topic, and I'll take care of it, and I'll bring you my point of view on whatever topics you want to hear about. So for right now, this is Dr. Lee Krol signing off. I'll see you tomorrow for the fitness. Exercise is medicine. Take care.